Hello everybody, it's Dr. Dan Pavlik. I'm here with one of my youngest patients, and she is dealing with some slight constipation and creating colicky issues at night where they get a little fussy, have trouble sleeping. So we're going to try to help with that with a little bit of hands-on manual chiropractic care. All right, so what we want to do is, obviously she's been a patient here before, so I've done a full exam and we've gone through the history with the mother, but she has done really well with some work on her intestinal area. So what we do is we find a little area in through here. It's right inside of the pelvis. It's called the ileocecal valve, and we put a little bit of pressure in there. Now, she is a very good baby. Most babies do not like me too much when I do this, but it really, really benefits them. So we get in there, we get a little, it's like a good pressure point, and you just try to loosen up that little valve in there. It's like a little muscle. It's where the small intestine goes into the large intestine. So it tends to tighten up, and what we want to do is we want to open it back up a little bit. So we just get in that area, move that hip around a little bit, and just kind of get those fingers right in that area and just put some pressure down and just try to massage it and open it up a little bit. I know, Pumpkin, you don't like me too much when I do this, but you're such a good patient. So then we kind of come in and we just massage up into that large intestine and across. We're just trying to move that bowel a little bit, just help influence that muscle motion, okay? So we're just trying to create a little bit of motion here, move those hips around. She's doing very good. We're going to kind of push down in through here a little bit. And then what we want to do is we want to check what's called the sacrum. It's part of the pelvis. So that's a big part. The pelvis and the sacrum in a child, in a baby especially, is very, very important. So we actually do a little bit of light manipulation on them by putting them into this little side position, and then we put a little bit of motion, and you can see she's very comfortable. And then we do a little bit of motion on the other side as well. Once again, just trying to keep the baby comfortable. Good girl. Sometimes you'll feel a little lower back restriction, but once again, that sacrum and that pelvis are very, very important. If you've ever heard of craniosacral therapy, is also very good for babies. So the sacrum is a key part in a child. Now, one of the other things we also see on babies and we treat as chiropractors are ear infections. Why ear infections are so common is because of the fact that the ear eustachian tube is more horizontal in a baby, so it doesn't drain as well like it does in an adult. In an adult, it drains down vertically better. So kids tend to get ear infections, as we hear about a lot. So we just always want to go in there and we try to do a little bit of drainage on their muscles inside of their ears. Once again, she is a very good patient. So she's not too fussy. There she goes. And most of them will eventually fuss at us for doing this. But it's a very light adjustment, just like the lower back was. And we're just trying to move that neck a little bit, to where we make them a little more, free up a little bit of restriction in their necks. And it's a very easy adjustment. And she's doing really, really good. Good girl. Good girl. I know. And that was a wonderful little adjustment by a wonderful patient. So thank you to her. And it's hopefully everybody got a little bit of good information about the benefits of chiropractic care in babies.